Welcome to Scoop and Scale, where we dish up the science and weigh the facts about mostly equine nutrition. I'm Jill Jackson, lifelong equestrian, podcast producer, and pony owner. I'm a dressage rider and at-home horse keeper, living the challenge of managing easy keepers on multiple acres of pasture.
And I'm equine nutrition consultant, Dr. Claire Tunis of Clarity Equine Nutrition. I develop diet plans for horses ranging from metabolic seniors to Olympic athletes. I also consult for equine nutrition companies. I'm a scientist, dressage rider, and pony club mom.
Claire and I have been horse friends for almost 20 years, and like all good horse friends, we're always talking horses. We talk about the challenges of managing our horses, our riding struggles, feeding horses, and what's going on in the wider equine community. This podcast is a place for us to have conversations mostly about equine nutrition. It's for anyone who wants to make better choices when it comes to feeding their horses.
And before we get started, a quick disclaimer. The information in this podcast is general and not meant to replace the individualized advice of your own qualified equine nutritionist or veterinarian. And while I have a PhD in nutrition, I'm not a veterinarian and can't give medical advice.
With that, thank you for joining us, and we hope you enjoy the following episode. Claire, you just got back from the Kentucky Equine Nutrition Conference in Ocala, Florida, where you heard from a number of leading experts on lots of interesting equine nutrition-related topics.
I did. It was a great couple of days, and it was fun to hang out with a whole bunch of nutrition nerds, all my peers, and lots of people from the feeding industry. And yeah, it was 2 days of great content and a really interesting range of topics, very applied topics, which I always really enjoy about this conference. It's very real world information that we can really kind of go home and use. Everything from Dr. Pagan presenting data on effective ways to cool horses. He's doing some really neat stuff with, you know how a lot of show horses now have to have microchips put in them for identification?
Yes.
Well, you can also have similar technology type microchips that actually read the temperature of the muscle that they're embedded in.
Fun fact.
So you can, yeah.
My horse has that microchip.
Yeah, well, most of us do have that microchip. I think this is a different microchip, right? But it's the same idea, right? And
wait, yours
so
has
it's a
the
microchip.
Temperature one?
You have a temperature?
Yeah, mine has the temperature one in it.
Oh, really?
Yes, I'm that cool. Living in Iowa with my field vet with my fancy microchip.
That's so funny. I did not realize. I knew that whole conversation about Jill getting her horse microchip. We won't even share it with everybody. But anyway, I did not realize you got a fancy one. I don't know that mine does temperature. I doubt it. It's been in there a long time. But anyway, yes. So there are microchips that can sense temperature, and so he shared some really interesting data where they could work horses, get them hot, see what the muscle temperature was, and then use different cooling strategies to see which ones were the most effective at bringing temperature down versus, say, just doing a rectal temperature, which doesn't really monitor what's going on in the horse's muscle. So that was fascinating. So everything from that to omega-3 supplementation in people, that was fascinating. And then relating that to what we know about in horses. And there is a very cool skin prick test that you can use for monitoring your own omega-3 status. And there's a ton of really good data about the importance of, human omega-3 status and health consequences. So massive studies, tens, hundreds of thousands of people over many, many years where they've looked at, influences of omega-3 status on your heart health, diabetes, stroke risk, mental acuity, all that kind of thing. And it's just fascinating. So there's now a blood spot test on the market for people that you can test your own blood omega-3 status. And then when you get the results back, you go online and punch your results in and they tell you how much you should be supplementing to get your omega-3 where it needs to be. So yeah, really, just really, really interesting stuff.
Neat. Well, several of the talks were tied to the nutrition of broodmares and foals, and we do get quite a few questions about feeding this group of horses. And given that we're entering the sport horse breeding and foaling season in the Northern Hemisphere, I thought maybe we could talk about this topic today and some of the things that you learned while you were at the conference.
Yeah, those were fascinating talks, and I'd love to share some of those things that we learned. And I can hear all the gelding owners going, "Oh, this episode's not for me." But I promise, even if you're a gelding owner and don't have any interest in breeding, well, there are some really fun, nutrition nerdy type tidbits that we learned that I just think are fascinating. So I hope our gelding owners will stick around and listen, because I just think they're fascinating. And you'll really be able to impress your barn friends the next time you're hanging out and they're bemoaning about something with their horse. It may be linked to something that we cover here that I learned about at this conference.
We're all going to have that friend that's like, oh, I'm going to buy a baby horse and I'm going to raise it and it's going to be wonderful. You can be the smart friend that has the answers for that person.
Yes, all the things that, hopefully we don't scare away too many people that are thinking of breeding, because basically what I came away, that the long and the short of it is we know a lot about feeding mares and foals, and there's an awful lot we still have to learn.
Well, when we breed a mare, I think it's safe to say that most of the attention is on the foal and what it will accomplish later in its life, and the foal is the focus. And as a result, a lot of people think about foal nutrition starting when the foal is born or even later when it's weaned. Would you agree?
Yeah, absolutely. I think that, a lot of the time we focus, a lot of focus gets put on the stallion initially, right? Because especially if you're a single mare owner, you kind of have the mare that you have, and you have to choose a stallion for your mare, and there's so many stallions out there that are all vying for your attention, right? So there's a lot of focus put on the stallion, and you want to make sure you make the right pick, and it's going to complement your mare, and you're going to end up with a foal at the end that's going to go on and do whatever it is your hopes and dreams are for that foal. So a lot of attention gets put on the stallion. That makes sense. If you're actually a breeder, hopefully, you've put together a well thought out group of brood mares that have specific traits and bloodlines and things over time. But again, each year you're having to make a stallion selection for each of those mares. So again, the stallion gets a lot of focus. And then, of course, the focus is on the foal, because at the end of the day, that's the whole reason we're breeding the mare in the first place, is to get a foal. So then the foal gets lots of attention. So there's a lot of interest in feeding the foal correctly to avoid complications and to have the greatest chance of success. But to your point, I don't think as much consideration is given to the mare, or even really thinking that foal nutrition begins at conception. And I would argue that maybe even it starts before conception, right? And mare nutrition is vital to the health and longevity of the foal. And we heard a lot about that at the conference.
So tell us more about that.
Yeah, so when I started equine, doing equine nutrition, we think about the mare nutrition as being important because the nutrients pass, obviously, while the foal's in utero, the nutrients have to pass from that mare across the placenta to the foal. And so we're feeding the mare, well, so that those nutrients are able to, be available to the foal. And so, we do think we're kind of thinking about feeding the mare and feeding the foal through the mare that way. And if we take vitamin E, for example, it doesn't actually cross the placenta. It's passed to the foal in milk, right? So that's an example of, it's a pass through. So you have to ensure that the mare is getting optimal vitamin E nutrition during pregnancy, so that in that last trimester, her vitamin E is where it needs to be, so that there's adequate vitamin E in the colostrum that then gets passed to that foal in the milk when it's first nursing and takes on the colostrum. It's going to get all its vitamin E at that point in time. So it is just this pass through. But we realize now it's so much more than just that. It's more than just feeding the nutrients to the mare so those nutrients can get to the foal. The mare is essentially programming the foal through epigenetics.
That sounds a bit space aged. What is epigenetics?
I know, it's appropriate, right? We've got people up circulating around the moon. It's this week, so it's space age science. It's all a thing right now. But yeah, epigenetics refers to the way that your behavior and the environment can cause changes that affect how your genes work. So epigenetics turns genes off and on. It doesn't alter your DNA, right? Your DNA is your DNA, but epigenetics is the switching on and off of switches in your DNA.
So what does that mean in context?
So in this context of like the nutritional status of the mare, for example, her metabolic status, whether she's suffering from systemic inflammation and, things like that, they're all going to regulate how the genes of the foal are expressed, right? So they aren't changing the foal's DNA, but they can impact whether switches in that DNA are turned on or off. And I think a good example, again, is with vitamin E, right? There's a neurologic condition called NAD, and it's linked to the vitamin E status of the foal. So we don't know yet what the gene is for NAD, but our current understanding is that if you're a foal with a genetic predisposition for NAD, like your DNA, sort of for want of a better expression, puts you at risk of getting NAD. And if at a specific moment in time, that foal finds itself to be vitamin E deficient, then the gene for NAD gets switched on, right? And this is irreversible, like it's switched on forever. And then that foal will develop NAD and display neurologic symptoms later in life, right? So in this case, this is specifically what we call nutrigenomics, right? The nutrition and nutrition impacting genes. And nutrigenomics is a form of epigenetics, right? Your environment influencing your genetic outcome and how your genes act, so to speak.
So the environment created by the mare while she's pregnant can impact the foal's long-term well-being and performance ability. Is that right?
Yeah, exactly. So mare nutrition and management during pregnancy and beyond is truly vital. And yet, as we said before, it's so commonly overlooked. And beyond early growth of milk production, which I think everyone thinks about, when they think about mare nutrition, it's about, is the mare making enough milk for the foal? Is the, mare producing enough nutrition for the foal? But the mare is also impacting what are referred to as, developmental origins of health and disease, right? And so these developmental origins of health and disease are the conditions around the time of conception, gestation, and then early, like postnatal life, when that foal is really young after it's born, that influence long-term health. So it's more than just the nutrition. It truly is the entire environment that mare is creating for the foal.
That's a lot to think about.
Right? Did I say that we have a lot still left to learn? Right? I mean, it's kind of mind-blowing, and it's sort of, and we don't know yet exactly how this works.
And it's funny too, like when we talk about that the mares, everybody talks about the foal, and they never talk about the mares. Like it's always like right at the last 30 days when the foal is about to be born, that people are like, oh, what should I be feeding my broodmare? Right. And it's like, well, wait a second. How long has it been pregnant for?
Months. I know. No, it's true. And it's so true. And so much development goes. The problem is, right, is that in the first trimester, you can't see what's going on. Like the mare doesn't change shape. She doesn't even really change that much shape in the second trimester either. So she doesn't even look pregnant. Like when you look at her, you don't even really think she's pregnant. It's not until the third trimester where you're getting a lot of skeletal development in that foal, and really a lot of that foal is really developing a lot of mass in that third trimester, that you start to see, at least I hope you're seeing, a change in the size of the mare, because the foal is, going from being tiny to potentially say 80, 100 pounds or whatever. So that mare physically gets bigger. That's when we go, oh, wow, yeah, the mare's pregnant. I should feed her something, right? But that first trimester, I mean, what's happening is, you're getting a lot of cell division, right? It's cellular level stuff. But from a genetic standpoint, it's vital, right? It's all the genes being turned off, switches being turned off, cells dividing. Then you have placental development, because you have to develop a really good placenta that's going to be able to shuttle the nutrients, to the foal and take waste products away from the foal, right? So you have, that has to develop, and you have to have a good, strong placenta to be able to then get all the nutrition to the foal so it can grow in the third trimester. But you don't see any of that going on outside the mare, right? So I think it's easy to not really think about it until, I see the other thing. I see, somebody who's, got a mare and they've decided they're going to breed that one horse they're going to breed is going to be they're going to breed their hot horse from their mare. And it's the opposite. It's like from day one of conception, they're wanting to like almost like overfeed her, right? Like it's just like, she's pregnant, so I must have to do something dramatically different. And the reality is probably no, not really. But it's just important to understand that at the end of the day, you just need to feed a correctly balanced diet, the correct number of calories, maintain your mare in good weight. But, she's not a machine, right? I mean, I think I'm starting to sound, I feel like having a feminist moment, right? Where I just feel sometimes like these mares get treated like incubators and they just kind of, get bred back to back, and they're not really seen as that important to the overall mission of producing the foal. And the opposite is true. In fact, they are the very foundation of your breeding program. You are nothing without your brood mares.
Okay.
So we certainly have a lot to learn. The
episode's over. Just kidding.
Soapbox
We said everything.
I know. So, there were some other interesting terms. A term that I had not heard before that I learned was predictive adaptive response.
Well, I bet you I could figure that out if I thought about it, but why don't you just go ahead and tell us what that's all about?
Right. So when the foal is in the uterus, right, it's adapting to its environment to maximize its chance of survival. So how it adapts in that environment can influence then how it responds through its entire life to various situations. So, for example, if a nutrient's deficient while the foal's in utero, it's going to adapt as best it can to maximize its ability to use that nutrient efficiently, right? It's going to try and figure out how to get by with less. And it'll use those maternal cues to predict what its postnatal environment will be like, right? Because it doesn't know any different. It thinks that the environment it's in while it's in utero, it's going to be similar after it's born, right? So it's setting itself up for life, right? So this is a great survival tactic, right? I mean, like if the mare is in not great shape and nutrition is lacking, then all the signals going to that foal are, you better be good at surviving in an environment that doesn't provide you what you need, right? And then if you're born into an environment that doesn't provide you what you need, you're more likely to survive, right?
Right.
But you may be metabolically more efficient, right? And able to get by on less. Great survival strategy, except it's not so helpful potentially if the environment that you then end up being born into turns out to be super abundant, right? And has lots of nutrition, because you've been wired to survive in an environment that doesn't provide you a lot. And then you find yourself in an environment that's like plentiful, right? So yes, but there's a potential there then for that horse to be at greater risk, for example, say of like obesity or metabolic disorders, for example, because of how it was programmed, how it adapted in utero.
So if I'm understanding this correctly, what you're saying is that genes set your potential, and then the environment impacts how these genes are expressed. And some of these effects can last for a lifetime.
Mm-hmm. Yeah, absolutely. I mean, we really are setting up our foals for life through the entire pregnancy, right? So my point of foal nutrition starts at conception, or maybe even before. I've said that for a long time, and I feel very vindicated now, right? that I've heard this research.
So mare nutrition during pregnancy has the potential to impact the foal's metabolism, the growth patterns, potentially long-term health and performance. You really are building an athlete from day one. Yeah. So was there any information shared specifically about mare nutrition and its impact on the foals?
Yeah, I mean, all the information that we've discussed so far was presented at this conference by Dr. Pascale Chavette-Palmer, and she's a researcher from France, and since 2006, she's led the placenta environment and programming of phenotypes research team at one of their research institutes. And, she also shared that even she said so many interesting things. I mean, for example, like even a moderate reduction of energy intake of say 80% of what the mare's actual requirement is can result in adaptations in the placenta. So she's really doing research, like looking at the placenta, looking at embryos, trying to figure out, what effects different diets and conditions are having at that level. And so what they found is that when you restrict energy intake by 80% of requirement, you'll see things like increased vascularization in the placenta and increased nutrient transport, which again, so speaks to my, what I shared earlier that she'd shared with us, which is that, foals that are in that sort of environment in utero are, the environment is trying to do its best to set that foal up for success as much as possible. So in turn, while the foals that are born to these mares didn't demonstrate, they didn't show any difference in birth weight when they were born because of that increased vascularization. So even though the mares didn't get fed enough calories, because the placenta adapted and sent more blood flow and more nutrients to that foal, there was no different in birth weights. But what they did see were impacts in long-term outcomes. So the foals born to those mares showed things like delayed testicular maturation. They had reduced insulin sensitivity at adolescence, and they also had reduced cannon bone width, right? So these are things that you won't see potentially for many months, if not years down the road. So changes were happening in the programming of these foals in utero. They looked completely normal when they were born compared to foals that didn't have that energy deficit, but there were consequences down the road.
What about a mare that's being overfed? Do we know what that may do to the foal?
Yeah, she shared some interesting information about that too, especially in first-time mares. So, when they're getting overfed during pregnancy, it can impact the foals. Specifically, mares that are obese in pregnancy may have offspring that are insulin resistant, right? They may have low-grade inflammation, and they also have an increased risk of osteochondrosis, right? Which is joint disorders when those foals are about a year old. So yeah, being overweight is also not good. So what's interesting is that the foals didn't show any difference in size again. So it wasn't a birth weight related issue. It wasn't that, because the foals were heavier at birth or what have you, that wasn't the issue. It was that the metabolic programming that was taking place while that foal was in utero was having an impact then on their, down the road. So I think one thing that's important to say, in regards here is also the potential risk of breeding mares that are already insulin dysregulated. And I do work with some of those mares sometimes, and, not from the fetal programming, uterine environment standpoint, but I think that it's important to understand that pregnancy tends to make mares a little more insulin dysregulated than they would otherwise be, same as in people, right? So nature has created this situation that when you're pregnant, the goal is, you're sort of sacrificing yourself for the good of the unborn creature, right? Whether that's a human, dog, cat, horse, right? Because at the end of the day, you want your genetics to continue and go on. It's about creating another generation, right? So on some level, you're sacrificing yourself for the good of the unborn foal or whatever. And so you want to optimize growth of that fetus while it's in utero at the expense of the mother, right? And so the body naturally sets up this situation where it makes the mother a little insulin resistant in order to make more glucose available to the fetus, right? So it doesn't go to the mother because the mother becomes insulin resistant. So then there's more circulating glucose in the bloodstream that can go to the fetus for the fetus's growth. And that happens naturally. Like that's a natural thing. It's good. It's no problem. The problem is if you're already insulin resistant or insulin dysregulated, before you get there. And then you add on this naturally occurring insulin dysregulation on top of that. In the case of some of these metabolic mares, you could potentially push that mare into a situation where she's at risk of laminitis. And we do see that. We do see mares in the last trimester suffering with laminitis, and that it's, I mean, crippling, right? It's really, that's extreme.
It's heartbreaking to see.
It's heartbreaking. And it's a big welfare issue, right? And I can't even imagine being the owner of a mare and being in the third trimester so close to foaling and dealing with a mare that's laminitic and potentially looking at the reality that you may have to euthanize your mare because it's the right welfare decision for her. I mean, that would just be devastating. So I think you really have to think carefully about the realities of breeding a mare if she has a history of being insulin dysregulated or has any history of laminitis, because it's a real wild card. You don't know how she's going to react to, that added insulin dysregulation that happens with pregnancy. And obviously, because she's pregnant, there are going to be some medications that she might otherwise be given if she were laminitic that she won't be able to have because she's pregnant.
Right.
And, for those that are familiar with pregnancy in people, it's the same reason why, as people, we go and we get tested for gestational diabetes, right? It's the same concern. In people, we're doing it because there's concerns about, overly large babies and then having dystocia issues. And obviously, we're not worried about laminitis in human babies, but it is the same sort of mechanistic situation from a metabolic standpoint.
So are there any tricks to getting mare nutrition right?
Yeah, I mean, we want to make sure that we're feeding a diet that supports conception, right, from the very beginning, and then supports the growing foal while it's in utero, as well as that ensuring that mare has enough condition on her when she foals that she can support a good lactation and create enough milk to support that foal. So we want her in good enough condition at foaling that she isn't needing to draw too significantly on her own body reserves. And this is especially true if you want to rebreed her. So I aim for a body condition score of 5 or 6 at breeding time, because mares that are either too fat or too thin are going to have a harder time conceiving. And then nothing much is going to change in that mare's body condition during the first trimester or even really the second trimester, kind of like we talked about before. But in the third trimester, like I think I said earlier, you absolutely should be able to see that mare getting larger because that foal is now growing quite significantly. And if that mare does not appear to be getting larger, it means that foal is getting bigger at the expense of the mare. Because like I said, nature is set up to favor the well-being of that unborn foal at the expense of the mare, if necessary. So if your mare is not visibly getting bigger in the third trimester, that foal is going to be growing and it's just taking nutrition away from that mare and condition off that mare. And then when that mare falls out, you're going to be in for a nasty surprise when you realize that she doesn't have as much condition on her as you thought she did. And now she's in a position where it's going to be hard for her to support that foal during lactation. So because, as I mentioned, the placenta development that occurs at the start of the second trimester, there is some increase in nutrient requirements starting at that time, but it's not much. And in fact, the difference in energy requirement between a mare at conception versus at the end of pregnancy is about the difference between as if she wasn't pregnant and was not working, so at maintenance, and her being in light work. And I think when people think about their horse being not working at all and just being in light work, maybe ridden 3 days a week for an hour, right? It's not much work. There's not a huge nutritional shift between those two. No. And that's the nutritional shift of a mare not being pregnant and being 11 months pregnant and ready to foal. So it's not a massive difference when it comes to calories, but what is super important are all the micronutrients that are being provided. It's really important that, you're getting enough calcium and phosphorus and stuff. And so for mares in good condition and for easy keeper mares, they often during pregnancy get by just being fed a really good quality forage. And as you can probably guess what I'm going to say,
A ration balancer.
Ding, 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 ding.
Always
Right?
the answer. Just start with the ration balancer.
When in doubt, right? Yeah, so the mare, at least for those first two, trimesters, because there's really little increase in caloric need. As long as you're feeding really good quality forage, you need the quality protein that's in the ration balancer, and then obviously it's vital that the calcium and phosphorus needs are met. And the calcium phosphorus needs also need to be properly balanced for bone development in that foal. Additionally, you need adequate copper, right? That must be provided as well. Copper is really important. Copper is required for collagen formation, and collagen is the foundation of all your bone, tendons, and ligaments. So if that mare is deficient in copper, that foal is going to be, in a situation where it may not be able to develop good skeletal structure. And in fact, there's data showing that foals whose mothers were copper deficient during pregnancy are at greater risk of developing OCD and joint disorders. And feeding the foal more copper after it's born doesn't reverse that risk. So the micronutrient status of that mare while she's pregnant is really important to the long-term soundness of that foal. As I mentioned earlier, vitamin E, right? That's important as it needs to be present in colostrum. So it's really important that the mare is getting adequate vitamin E in that third trimester. So I recommend that mares have their vitamin E levels tested at the start of the third trimester so that if they are deficient, you have time to get them back to where they need to be before they have to make colostrum, right before foaling. And then, for those harder keeping mares, for the ones that can't just maintain themselves on forage and a ration balancer, or for mares that are still lactating because they had a foal the year before, maybe they're still lactating and you've bred them. Those mares obviously may need a more calorically dense feed to be added to their diet. But I try to stay away from feeding too much cereal grain to pregnant mares because there is some research suggesting that, these can lead to metabolic shifts in the mare that can have a negative consequence on the foal, such as, negatively impacting cartilage and bone development. So I try to pick what feeds I do feed kind of carefully. And I also try to avoid making nutrition changes right around birth. Like, I figure that it's stressful enough at birth on that mare. Like, first of all, if she's a maiden mare and suddenly she's like, what the heck is that? Right? She's got a foal all of a sudden with no experience on what she's doing. Her hormones are all over the place, right? There's a lot of big changes going on. I don't want to throw a diet change on top of that. However, a lot of mares are going to need some amount of a more calorically dense feed during lactation, even if during pregnancy they were fine on just hay and a ration balancer. They may need some more calories on the back end. So I do like to introduce a small amount of whatever that higher caloric density feed, whether that's normally it's a growth feed, right? I like to introduce a small amount of that in the last month before foaling so that isn't a new addition. Maybe that mare falls out, she holds her weight beautifully just on hay and the ration balance, and I don't need that growth feed, and then I can just remove it. But if it's already in there at like a couple of pounds a day, if we get to, a couple of weeks after foaling and we realize, this mare needs some extra support, it's already there. I can gradually start to increase it. I'm not adding something new to her and potentially kind of creating another change that she has to handle.
I just thought of something. When we're talking about the effect, I know. When we're talking about the effect of the maternal environment on the foal well in utero, what about if the mare isn't actually the genetic mother of the foal? Like, embryo transfers become pretty common in performance horses because it allows the mare to keep competing while another mare carries the foal. What happens in this situation?
That's a great question. I can see you've been, while I was rattling on about feeding broodmares, you've been sitting there thinking about uterine programming. So we know that the size, the metabolic health, and the nutrition of the recipient mare does affect fetal growth. So we know that the size, metabolic health, and nutrition of the recipient mare affect fetal growth. So yes, selecting a recipient mare carefully that's a similar size as the actual mother is very important, which I don't know that people think about that much when they're selecting recips, but that is something you should consider. And there are differences between breeds, and the data presented at the conference recommended that recip mares be the same breed as the foal's actual mother. And they looked at how embryos that are raised in a recip mare behave, and the outcome is a great way. It's actually using recip mares is a great way to separate out like what is like DNA and genetic coming from the foal, so to speak, and what is actually the result of the uterine environment that the foal develops in, right? So it's actually a great way to do research. And the research that was shared at the conference showed that when you put pony embryos into draft mares, fetal growth actually increased by as much as 57% in some instances. So that's huge, right?
Wow.
Yeah. It was funny. She said that she did not feel confident going the other way and putting draft foals into ponies because it's a bit of an unknown, right? It's unnatural. You wouldn't do that. I mean, obviously there's that scientific curiosity of what happens when you put a draft foal in a pony uterus, but what happens if something, wasn't good, right? So they haven't done that. But growth in these horses, when they put the pony mares in the drafts, the growth looked great up until about 18 months. However, it did affect metabolism, including insulin resistance at weaning. These were noted in early life. Similar work where pony embryos were put into thoroughbred mares showed alterations in blood pressure shortly after birth. So there are some things happening when you, when you put, foals of one breed into mares of other breeds, especially different sizes.
So they did put a large breed embryo into a pony-sized mare?
Yeah, just not a draft. I mean, I said that she did say they didn't feel confident putting a draft into a pony, but I think they did put some saddlebred foals into pony recipients, and it was found to restrict fetal growth. And the foals were smaller at birth. They grew more slowly after weaning. In another case, they put so they have done that. And again, so doing this kind of research really shows the impact of the uterine environment of the host mare having an effect on the fetus beyond genetics.
Does the age of the mare or how many foals she's had have any effect on the new foal or on the foal being born now?
That's a good question. There was actually another talk by Dr. Pagan. He has some phenomenal data looking at growth rates in foals. They've been collecting for many years in thoroughbreds around the world, and they've probably thousands of thoroughbreds. And so they've looked at that. Like they've looked at, whether it was a first-time mare, whether she'd had multiple foals and the effects that it's had. And again, Dr. Chevette Palmer also discussed it. And foals born to first-time brood mares, or what we call primiparous mares, tend to be smaller. In racehorses, by the time they were yearlings, Dr. Pagan showed that they've caught up with foals that were born to mares that have had multiple foals. So by the time they get to a year old, that difference has disappeared. And interestingly, we kind of know this to be true from other breeds. Like we know in cattle, right? Like Angus, sort of Angus cows, we often farm and beef producers will often use an Angus bull on their heifers when they have their first calf, because obviously Angus calves have smaller heads and they're a little bit smaller, and so they get less dystocia issues. And then the next time that cow gets bred, they'll put a different, maybe the cow's own breed bull. So yeah, we kind of know this in other species too. But embryos from older mares show altered gene expression. So I think that's really interesting, because it's not uncommon that people will decide to breed their older mare, right? Especially if she has an injury or something, or they just suddenly, for emotional reasons, decide, at 18, they want to breed their mare and she's never been bred before. But they do see altered gene expression that suggests that they may be developmentally delayed. And it's thought that that might be part of the reason why it's harder to breed some of these older mares successfully, because they're, they're just not, there are delays in the embryos, and they don't function the same. It's also thought that there are shifts in the pathways responsible for inflammation, right? So then we might see more inflammation in those older mares that has an effect on the embryos. And so one thing I thought was really interesting is that regardless of the age of the mare, if she's lactating while she's also pregnant, her pregnancy tends to be shorter and her subsequent milk production tends to be reduced, which can then impact the growth rate of that foal when it's born. And we see this a lot, right, in brood mares, because a lot of breeders breed back to back. So it's not uncommon that your mare has a foal. You then take that mare back to their breeding shed, either on her foal heat or the next heat, and you're rebreeding her, a couple of months after she's had her foal. She gets pregnant, so she's got a foal at foot that's lactating while she's pregnant with her next foal. That scenario can have an impact on the next foal when it's bred, like its growth rate. So these foals may need more nutritional support, especially around month 4 of lactation, when milk production levels tend to drop anyway, because she's already producing less milk because, she was lactating another foal when she had a foal on her.
This ties back to what you were saying earlier, because if the mare is not in good condition when she foals, she'll have less body reserves to draw from to support lactation and produce milk.
Yeah, exactly. I mean, it's interesting. It's one of those things that when you think about it, this research, it's sort of not really surprising because, to what you're saying, like if I have a mare, she has a foal, I don't really feed her adequately during lactation. So she then uses a lot of her body condition to create the milk she needs for that foal. Meanwhile, I've rebred her. By the time that second foal hits the ground, I now have a mare who's not in such good condition. She doesn't have the body fat reserves to generate milk supply. And so on some level, of course, her milk production is going to be lower for that second foal, right? So absolutely, like keeping those mares on, a good plane of nutrition and in good body condition is really important. And I'm surprised by, I've met more than, one breeder over my career who, it's just sort of accepted that periodically mares they don't have a foal, or that just happens, every 3 or 4 years, we just don't get her bred and what have you. And I'm looking at this mare who's so kind of spent physically, right? She doesn't have enough condition on her. And I just can't help but thinking that if you could do a better job of maintaining condition on that mare while she's lactating, she'd be more likely to get pregnant and is successful. And obviously, if you're a commercial breeder, skipping a foal in a year that's real money that you're missing out on potentially, especially when some of these sport horse foals are selling for $10,000, $15,000, $20,000 as weanlings. That's a lot of money to leave on the table.
Who's buying a horse for that amount of money? Have you?
I don't know.
Listen, I'm in the horse market. You're not buying a horse for that price. I don't care that it's a foal.
You're not in utero. Foals in utero, $20,000 for a warm blood foal in utero. Maybe I'm way off, but I don't, anyway.
I think you're too low. Anyway, we're not going to talk about selling.
Whatever. I mean, but still, that makes it even worse if I'm wrong and you're right? There's even more money that's being left on the table if that mare doesn't get bred.
But I think the other thing to say here too is like when we talk about, the condition and they don't get bred, but like I've seen lots of recip mares and they never look great. And people just are like, oh, well, it's just a recip mare. She was just lame, so we bred her. Or, I just have her for the breeding season. And you can see their spine and their hip bones and they just, they don't look thrifty. They don't look, what's that pregnancy glow? They don't have it.
I can feel my blood pressure. I'm getting back on my soapbox here.
No, but I think that's really
that's right, though. It's true.
Yeah. It's sort of sad, that people, they don't, I don't want to say they don't care. It's not that they don't care. It's just that they have this in their head that like, oh, it's just a recip mare. But, she has a big responsibility. And like you said, like she's producing whatever foal, you've got going on in there. And so to not take care of those recip mares and treat them appropriately.
Well, especially now we understand all the fetal programming that's going on based on uterine environment and stuff, right?
Right.
It
seems that we have a pretty good grasp on how to feed brood mares for success, but that there's still a lot we have to learn. about the subtleties and the things that have the long-term effect on foals.
Yeah, absolutely. Right. And it takes some really long research trials, right? Often, like some of the things that I've shared that we're seeing are affected by this are not obvious at birth, right? They may not be obvious for 12, 18 months, or maybe even longer, which makes it challenging to study, right? Because it's hard to do that kind of research. But Dr. Trevette Palmer and others are working to try and identify these epigenetic markers in embryos and placentas in the hopes of being able to develop tools for breeders and veterinarians so that we can better manage broodmares for optimal outcomes, and hopefully improve the long-term health of our horse population, because the reality is that we really are setting up these horses for life by how they are fed, how the mares are fed while they're pregnant, how the foals are fed when they're in utero, and shortly thereafter truly does set that horse up for life.
For our listeners, if you'd like to be a part of our conversation, please send your suggestions for future topics and equine nutrition questions to info@scoopandscale.com and is spelled out. You can also find Claire at clarityequine.com.
We know that if you're like us, you're probably listening to this while driving or doing barn chores. But when your hands are free, if you'd share it with your friends on social media and be sure to subscribe on your favorite podcast platform, it helps other horse lovers like you to find us.
For the Scoop and Scale podcast, I'm Jill Jackson.
And I'm Dr. Claire Tunis.
Thanks for riding along with us.